Good evening. My name is Julia Sexel, registered nurse. Today I will be performing my nursing health assessment, and my acting patient will be my husband, Mackenzie Sexel. And I will start my simulation now. Knock, knock. Good evening, Mr. Jones. How are you?
Doing awesome.
Awesome. Let me just wash my hands so we can get started. My name is Julia Sexel. Nice to meet you. Good. Nice to meet you. I will be your nurse today. Today we will be doing I will be doing a health assessment, a thorough health assessment from head to toe. And the only reason why we're doing it, we just want to make sure everything's okay. And I promise I will let you know everything that I'm doing and why I'm doing it. Okay? First thing, safety first. Let's check that armband to make sure we've got the right patient. So I've got on here, this is Mackenzie Jones. Date of birth, 12/01/1981. Medical record number, 123456. Is that all correct, Mr. Jones?
Yes.
All right, Mr. Jones, since you already, can you state your full name again for me?
Mike Jones.
Okay, Mike Jones. And can you state your, where are you? Can you tell me where you are right now?
Hospital.
You are in the hospital, correct. And can you tell me who's the president of the United States? And what year is it?
2017.
2017, awesome. So it looks like you are alert and oriented to person, place, and time. Very good. And your general appearance, I'm looking at you, Mr. Jones, and you look pretty good. No signs of distress. Skin looks, general appearance looks pretty good. Let me check your IV site to make sure we have no problems in that area. I'm just going to touch that area. I just want to make sure there's no tenderness and there's nothing wrong with that IV, okay? When I put my finger here, is that tender? Does it hurt?
No.
Okay. And there's no signs or symptoms of swelling or infiltration, no redness noted, and no kinks in the tubing noted. So everything looks good. Awesome. We're off to the right track. Awesome. So the first thing I'm going to do, we're going to do check your hair, skin, and nails. Just to make sure there's nothing wrong. Okay? So if you can do me a favor, I want you to lean forward to me. I'm going to inspect your scalp to make sure there's no redness, no swelling, no observable swelling or skin abrasions noted. Looks pretty clear. Looks pretty good. And then next I'm going to take a look. Let's take a look at your skin. Bring your arms, stretch them, stretch them, stretch them. Awesome. Skin looks intact. Skin is warm. Skin turgor looks good. Very good. And body symmetry looks pretty equal and symmetrical. Very good. Let me check your capillary refill, and all that is, I'm just checking to make sure your circulation is good. Blood flowing the right way. Good, okay? So let me check this finger here. Capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds on this hand. If you can hop right here on the bed for me, you can lay down, and we're going to check your feet to make sure you've got blood flowing to those feet as well. Capillary refill is less than 3 seconds on this foot here, and capillary refill is also less than 3 seconds. There, very good. Now, the next thing I want to do, I want to inspect your head, eyes, ears, nose, and throat. Okay? So I'm going to have you do a little exercise for me again and sit up for me. Okay? So head looks pretty good. I'm going to take a look at your ears. Any drainage from your ears? Any pain in the ears? Any dizziness or anything like that? No. Let me take a look at your eyes. Let me grab my pen light here. Okay, take a look at me. Pupils look round. They're equal. They're reactive to light. Okay, and they are accommodating. Perfect. Let me take a look at your nose. I want you to lean your head back for me. No signs or symptoms of drainage. Looks pretty good. Looks good. Do you have any questions or concerns about your nose or anything else? I want you to open your mouth for me. Let's take a look at that mouth to make sure no infectious process, nothing crazy is going on in there. Say ah and stick your tongue out for me. Let me use my tongue depressor so I can take a look at that throat, okay? The back of that tongue. Looks pretty clear. No redness noted, no swelling, no lesions on the tongue. Let me see again. Open that mouth for me. Okay. And your mucosal, your mucous membranes look pretty nice and pink. I like pink. Okay, very good. So the next thing I'm going to do here, let me just check this off. Know that we did that. I want to make sure that let's check your breathing status. Have you had any issues breathing?
No, no issues.
No issues, no chest pain?
Nothing.
Nothing? Okay. If you can do me a favor, I want you to sit on this chair with your back facing me. Yeah, we can leave the chair like this. There we go. With your back facing me. And I'm just going to check your lungs to make sure that you don't have any wheezing or any gunk. I mean, even from you just talking to me, I don't see any observable signs of, wheezing or anything like that, but let's take a listen. All right. Take a nice deep breath for me. Deep and out. Beautiful. Again. Again. And deep breath in. Beautiful. Awesome. Awesome. You can come on back over here, Mr. Jones. And sit there for me. And forgive me if I am, I've seen a couple patients today. So if I'm calling you another name, please don't be afraid or hesitate to correct me. Okay, Mr. Jones, and I do apologize about that. All right, so I'll check that off for you. Next thing, I want to check your cardiac status, your heart status. And all I am, everything that I'm doing, I just want to make sure that your heart is doing exactly what it needs to do, okay? So the first thing I'm going to do, I'm just taking a look at your carotid arteries here, okay? And I'm going to feel with my fingers. And my fingers are a little cold, okay? Because it's cold in this place. They don't believe in fixing our temperature. Can you sit up for me? Down. Beautiful. Beautiful pulsation. Okay, no bruit noted on that side. Beautiful. No bruit noted on this side. Beautiful. So so far it sounds like that heart, it feels like that heart's doing what it's supposed to be doing on that carotid. Okay. All right. Next, I will check your PMI, the point of maximal impulse, okay? I'm just putting my hand here. I just want to see that impact of that ventricle, how your heart is pumping. And again, all I'm doing with this cardiac assessment, I'm just making sure your heart is pumping good. So no lifts or heaves noted. So that's good. I like that. All right. So, and I will, as a note, I will palpate the PMI at the 5th intercostal space, mid-clavicular line. Okay. All right. Now I'm going to take a listen to your heart sounds here. Let me bring my clipboard over. If you can do me a favor and take your shirt off for me, and then I'll have you lay down, okay? So it can be more comfortable for you. We're halfway done, Mr. Jones. Halfway done. And I'll keep you covered. Here you go. Go ahead and lay down for me. Pretend like you're in paradise. Just relax. Close your eyes. And just breathe. There we go. Okay, I'm just going to bring this down here. Okay, so first I'm going to listen to the aortic area. which is located on the right sternal border, second intercostal space. Next, I'm going to listen to the pulmonic area, which is located on the left sternal border, second intercostal space. So far sounds good, Mr. Jones. Next, I'm going to listen to the Erb's Point area, which is located on the left sternal border, third intercostal space. Next, I'm going to listen to the tricuspid area, which is located on the left sternal border, fourth intercostal space. That heart sounds beautiful. Are you active?
Yes.
Yeah. Go to the gym a lot?
Mm-hmm.
That's good. And then I would auscultate the mitral area over the fifth intercostal space, mid-clavicular line. Very good. Go ahead and sit up for me, Mr. Sexel, and you can keep that sheet on just to keep you covered. Have you been having any nausea, diarrhea, vomiting lately, any abdominal pain? No? Okay. Go ahead and lay down again for me. Sorry about that. Alrighty. I'm just going to take a look at your stomach, just a general appearance of it. Looks symmetrical on both sides. And now I'm going to listen to your bowel sounds, okay?
Mm-hmm.
To make sure everything's moving all right. When was your last bowel movement?
3 hours ago.
3 hours ago. That's good. Are you pretty regular?
Yes.
Yeah, that's good. Beautiful. And bowel sounds are active and present in all 4 quadrants. No bruise noted. And if no bowel sounds were present, I would listen in each quadrant for a total of 5 minutes in each quadrant. Very good. Have you been urinating okay, Mr. Jones?
Yes.
Yeah. Have you been running to the bathroom a lot? Any burning when you urinate? No urgency or anything like that? Okay. Well, just to let you know, while you're here, we will be monitoring your intake and output throughout your whole stay here to make sure that, you know, your bladder is working correctly. Okay? And then let me just double check. And then let me just double check your extremities here to make sure if you have any swelling or anything crazy going on here. Okay. And it looks like you have no swelling. Let's check. Any numbness or tingling on your feet? No? Let me check those pedal pulses, because I forgot to check them earlier. They are palpable and they are equal on both sides. Let me check that radial pulse. And they are palpable and equal on both sides. Beautiful. Well, Mr. Jones, you can sit up, put your shirt on, make yourself comfortable. Welcome again to Moffitt Cancer Center. I'm making sure that your nurse's call button is close by, so it's right here when you need it. Please, if you feel like you're about to pass out or any sign or hint of dizziness, I do not want you getting up out of this bed by yourself, okay? And also the bed is at its lowest point and the side rails are up. And I will make my way out. I'll wash my hands and let you enjoy the rest of your day. It was very nice meeting you. You take care of yourself, okay?